Just preparing to stream, so just give it a minute. Okay. Welcome everybody to the New York Bariatric Group. This is our live streaming event with bariatric surgeon, Dr. Jeff Chiao, as well as plastic surgeon, Dr. Shuja Shafqat. Thank you everybody for joining us this evening, and we're gonna go ahead and get started. So Dr. Chiao, do you wanna introduce yourself?
Yes, thank you, Megan. Thank you everyone for attending this question and answer session. I hope it's very informative, and we'll be happy to answer any questions that you may have. So my name is Dr. Chiao. I'm one of the surgeons with the New York Bariatric Group. The New York Bariatric Group is the largest bariatric group in the United States. We have over 27 to 30 surgeons, and we do many surgeries every single year. I've been with the practice for about 8 years or so. I did my training at the University of Pittsburgh for fellowship before I joined here. I focus mostly my practice in Long Island and in Manhattan, but we have offices throughout the tri-state area and farther as well. So again, thank you very much for joining this live stream, and I hope you find it informative.
And then, good evening, everyone. My name is Dr. Shuja Shafqat. I am a plastic surgeon with NYBG Plastic Surgery and New York Bariatric Group. I've been here for about a year so far. I was in practice for several years in Philadelphia before I joined the group. We, from a plastic surgery standpoint, we focus on a lot of the body contouring options after weight loss, whether it's through medical weight loss, diet and exercise, surgical means, any of those things. So that's what we kind of specialize in. We also basically service all the areas that the New York Bariatric Group does throughout the tri-state area, focusing in Long Island. I mostly practice in New Jersey, but I also see patients in the Westchester area, Staten Island, New York City, and then we have offices in Connecticut as well. So like Dr. Chiao mentioned, thank you for joining this. Hopefully you find it informative, and please ask questions at the end. We're more than happy to answer all your questions. So just to start, we'll start with a couple of questions for Dr. Chiao about bariatric surgery. So, we get a lot of questions about the safety of bariatric surgery. I think a lot of people have heard kind of the horror stories about when bariatric surgery first started, and we've all kind of seen, as we do these, how they've evolved. So, Dr. Chiao, is bariatric surgery safe, and how has it kind of evolved over time from when it first started until now?
Yeah, so that's a great question. So first of all, just to be very upfront, bariatric surgery is extremely safe. It's one of the safest operations that you can actually undergo. Bariatric surgery has been done for many years. It actually started back in like the 60s, 70s or so. And back then, surgical technology, surgical techniques really aren't where they are today. So a lot of the stories you may have heard of patients that didn't do that well or had issues really were in the earlier days of bariatric surgery, when we were doing big open incisions, large scars, big operations, things like that. As time has evolved, we're doing everything laparoscopically with little incisions, sometimes robotically. And with the technology nowadays, with the different types of techniques we have, it's become extremely safe. The risk of having a complication of any kind is about 0.2 to 0.5% chance. So it's about 1 in 300 or 1 in 400 patients. So it's extremely unlikely. In terms of mortality or someone having a very bad outcome, it's extremely rare. I'd say probably 1 in 100,000. So that's really not something that we see anymore with the techniques that we have nowadays.
That's awesome. I'm always amazed at what you guys do laparoscopically or robotically, and how much you can change one person's life in a 30 to 45 minute operation, through a couple small incisions. You hear a lot about different procedures, sleeve, bypass, duodenal switch, all these types of things. And I know certain techniques have kind of gone in and out of favor. So how do you counsel patients on what the best surgery is for them, and how do you help them decide?
Sure. So we really customize it for the patient. When a patient comes in to see us, we do a full consultation. We get a full medical history, surgical history, look at their height, their weight, medications, and we really have a discussion with the patient about all the pros and cons of each operation, what we think is going to be the best option for that patient be both very safe as well as very successful. Now, some patients certainly have their own ideas or what they like to do. And of course, because it's an elective surgery, we always do what the patient wants. Having said that, we try to come up with an educated decision where we go through all the pros and cons and really try to customize it for each patient individually. There are several different surgical options out there, and they could be quite different. And so some patients may benefit from one, whereas some patients may benefit from another. So we really try to customize it as much as possible.
That's great. With the techniques for robotic and laparoscopic surgery, obviously, there's minimal in terms of, incisions and things like that. So how much time do patients need off after bariatric surgery, and kind of what is their general recovery process?
Yeah, so we tell most patients that they need about 1 to 2 weeks off of work after they've had a weight loss surgery. Now, this will depend depending on what kind of job they do. So if a patient does a lot of heavy lifting, a lot of outdoors activities, strenuous activities, then we may hold them out for 3 to 4 weeks. For someone that works at home, which we certainly see more of nowadays, we have had patients go back to work 2 or 3 days after surgery from home behind a computer or something like that. In general, if you're doing an office job, not too much lifting, not too much activity, most patients are able to go back within 1 to 2 weeks. And certainly we're able to provide, a letter for you if you need, or fill out any forms that you need to go back to work. But that's usually the rough guidelines.
Okay, awesome. And then probably the most important question, but how often do patients need to follow up after they have bariatric surgery, and how do you kind of guide them after they've had the surgery to getting to their goals?
Yeah, so follow-up is a crucial part of being successful after weight loss surgery. The surgery itself is just the very beginning. That's just a change in your body and a tool to help you lose weight. Unless we use that tool, patients aren't going to be that successful. So we have to utilize that tool as much as possible. And the way we make sure you're using that tool properly is by follow-up appointments. In general, patients follow up 1 week after surgery and about once a month or so for the first year. So we'll be seeing each other quite frequently for the first year to make sure that you're eating and drinking the right types of things, being physically active, taking your vitamins, exercising, being physically active, and all of those things to make sure you're utilizing the tool as much as possible. After about a year or so, most patients are at their goal. And so we tend to stretch the visits out a little bit after that. So every 6 months after that, and yearly, long-term. Ideally, we like to see our patients lifelong. I know it's not always possible, but we like to have our patients come back at least once a year just to say hi, make sure you're doing well, make sure there's nothing we can't do for you. Sometimes long-term patients may regain 5-10 pounds. And if you come back, we can definitely work with you to try to get that off. So we like to see our patients for as long as possible. So long-term follow-up is definitely very important after surgery such as this.
That's great. I think the thing that the way you phrased it was important, is using the surgery as a tool in kind of the process of weight loss. And again, if you don't use that tool correctly and utilize all the other resources available, in terms of nutrition and all that stuff, then that's where I think it's helpful. And I think especially in our group where we have all those resources built in, it makes it a lot more successful, I think.
Yeah, you're absolutely right. It's a very powerful tool. Almost all patients that have the surgery are very successful and are very happy with it, but it is a tool that patients have to use. And as you mentioned, with our practice, we do have all of these resources here. So we have nutrition, psychology, cardiology, pulmonology. We also have all of the online support groups for both before surgery, after surgery, live streams such as this, question and answer sessions. So we really do our best to try to support our patients afterwards. And after surgery, all of these sessions, all of these seminars are completely free of charge. So we encourage that patients really follow up, if not with the surgeon in person, with at least some of these support groups to make sure that you really have the best possible outcome, because the aftercare after surgery is just as important as the surgery itself.
Well, that's great. Well, thank you for answering those questions. I think that's really helpful to give people a very general overview of bariatric surgery.
Oh, my pleasure. And so I'd like to ask you a few questions. So one of the things that almost all patients ask us when they see us for a weight loss consultation is, what do we do afterwards? I lose, let's say 150, 200 pounds, and I have all this extra skin. What can I do to get rid of that? So can you kind of go over exactly what are the options for the patient after they've lost a significant amount of weight, and just kind of go over into some of that?
Yeah, so those are great questions. So, post-bariatric body contouring surgery is definitely kind of a niche subspecialty of plastic surgery, because while they are very similar to procedures that we do in people who have not lost a lot of weight, they're also very different. We have to take those into account. So, special things that we do to make sure that those patients have the best outcome possible. An abdominoplasty or tummy tuck in somebody who, has just had several pregnancies or has not lost, 150, 200 pounds is very different than one we do in somebody who has lost all that weight. So there are a variety of different types of procedures that we do for post-bariatric body contouring surgery. And we just noticed that when you lose weight that fast, your skin just does not bounce back the way it does, and certainly as we age, our skin quality loses a lot of that elasticity or the ability to bounce back. I'm sure you've seen patients who are younger who have weight loss surgery where their skin bounces back a significant amount versus patients who are older. So, patients just develop a lot of excess skin. And the most common areas we see are definitely the abdomen or the trunk, the chest area. So the chest for men or breast for women, the arms and the thighs. Those are probably the most common areas that we see. And so there's a variety of different types of surgeries that we do for each of those different areas. So for the trunk, we talk about, an abdominoplasty or tummy tuck, but more commonly we talk about things like a lower body lift, which is a 360-degree tummy tuck or abdominoplasty, or a fleur-de-lis tummy tuck, which is a tummy tuck that has a up and down scar as well as a horizontal scar. For thighs, there's a variety of different ways to remove that excess skin. Arms, we typically talk about arm lifts and removing a lot of that excess skin with liposuction. Breasts, we talk about breast lifts and breast reductions for certain patients, and then, adding volume for certain people, either with implants or fat. So there's just a huge amount of different options. And one of the things that's always interesting about plastic surgery is it's very kind of gray sometimes. So if the joke is if you ask 10 different plastic surgeons their opinion on something, you'll get 15 different answers. And so, everybody kind of has their different techniques for things, what works well in their hands, but it's definitely a very up and coming kind of niche subspecialty of plastic surgery. And like I said, it's very different from what we do in patients who have not lost a lot of weight. So that's why it's important to go to somebody who has a lot of experience doing those types of things.
Sure. And with the amount of patients that we do, we certainly probably have the most experienced plastic surgeons in the area that specialize in body contouring. So it's definitely good that you're able to offer such a wide gamut of procedures and different body parts. Would you ever consider doing all these surgeries at the same time, or do you usually prefer to space it out and stage them?
Yeah, that's a good question. We actually get this question a lot. And so I think, the biggest thing, and I'm sure you agree with this, and almost every surgeon agrees with this, is number one thing is patient safety. And the thing about what we do and you do is that, it's elective surgery. And so we have the ability to optimize people, optimize comorbidities, make sure your diabetes is under control, make sure your blood pressure is under control, all those types of things. And so trying to make sure patients have the safest surgery possible and the best outcome possible, minimizing risks, is certainly paramount in every surgery, in every medical field, to be honest. So it really depends, I would say. And again, it comes down to how safe can we be? How much time are we keeping somebody under anesthesia? Because the longer you keep somebody under anesthesia, the more likely they are to have a complication. And things that we see, especially with procedures like this, blood clots, wound healing issues, blood loss, and things like that. So it really just depends on how patients are going to combine those surgeries if they want to do more than one thing at one time. Again, people go back to looking at, the non-weight loss patients, and, patients will get the quote unquote mommy makeover, which is, like an abdominoplasty or a tummy tuck with a breast surgery. And again, they're different surgeries in patients who've lost a lot of weight. They're much more extensive. Patients' tissue quality is sometimes not as good depending on what type of bariatric procedure they had. And so it really just, the way we combine them has to be in a way that's safe. And it really just depends on what people want to do. So like, if I'm doing a lower body lift or 360-degree tummy tuck, I'm usually not going to combine that with something else. But if somebody's doing, simple skin removal from the front of their belly and they maybe want to do something else, and I know I can do it safely within a reasonable amount of time, then sometimes we can do it. So, but usually we try to stage them. Not only does it decrease the risk, but it also makes their cosmetic outcome better. It allows us to put scar positions in a better area as things kind of heal. So that's usually my recommendation for people.
Sure. And I think that's very reasonable. I mean, safety is always any surgeon's main concern, especially in our practice. It's always what guides us. And so it's definitely interesting to hear that. What's the recovery time for something, let's say like an abdominoplasty or a lower body lift, something like that?
Yeah, so these are, they're very unique procedures because they're typically, what people will look at because of the amount of incisions they have as kind of what we say is the biggest surgery that they're going to have, because, people have all sorts of different types of procedures and stuff like that. But typically for most patients, this is going to be the biggest surgery that you've had thus far. So it's a lot of incisions to heal. And that's kind of the limiting factor on recovery time. So we definitely want people to be up and moving. We don't want people to lay around. Everybody asks, how long am I going to be in bed? Really not at all. The day of surgery, day after surgery, you should be up and moving, decrease the risk of blood clots and opening your lungs back up after general anesthesia. So typically we say when you're back to full activity, you can do whatever you want, is usually about 8 weeks, but you're increasing your activity as you go. So like you mentioned, depending on the work that you do, if you're doing a desk job, you're working behind a computer, working from home, most of the time, 2 to 3 weeks, you can go back to work. If you're doing something a little bit more strenuous, then we're talking about 6 to 8 weeks. But, what we usually tell people is, light cardiovascular activity at about 3 to 4 weeks, and then back to heavy lifting more than like 15, 20, 25 pounds, usually at about 6 to 8 weeks. And typically after 8 weeks, if everything has gone well, which typically it does, then patients can pretty much go back to whatever they're used to as they slowly ramp their activity back up.
Yeah, I definitely think, with both of our surgeries, early ambulation, getting up, being active early is the most important thing. One of the most dreaded complications or issues is a blood clot. And so we certainly want to do all that we can to try to prevent that. So that's a great information to have. So I think we may be able to open it up to questions from the audience now, so we can start to address those.
Yeah, so the first one I see in our chat looks like it's for me. So how does the doctor determine what area for skin removal first? So that's a great question. We typically like to do things in a certain way just because, again, the reliability of things and the ability to place scars in the best way possible. Typically, the way we say is we deal with the trunk first. So, abdominoplasty, lower body lift, something like that. And then it depends on the patient. A lot of patients are really bothered by their thighs, so we may go to their thighs after that. But typically, second, most people are bothered by the upper body. So, the extremities or the arms, the breast or the chest area, and then thighs usually after that. And then if, there's some facial issues, some people have like loss of volume, they have excess skin in their neck, then we would typically go to that in a fourth stage. But a lot of it just depends on the patient, what areas bother them. Some people aren't bothered by the belly, they're really bothered by their arms because, that's, when in the summer when they're wearing a t-shirt or something like that, that's very bothersome to them. So a lot of it just depends on, the patient and what they want to do.
Sure. I think the next question is for me. Does surgery help with reflux? So, it really depends. A lot of times obesity itself can contribute to heartburn or reflux because with an increased abdominal fat and weight, you actually have increased abdominal pressure, which can push the acid kind of up into the esophagus and cause reflux. So losing weight itself can sometimes make reflux better. Now, before any weight loss surgery, we do an endoscopy to look down inside the stomach, and we find severe ulcers, a severe inflammation of the stomach or the esophagus. Then we may discuss a surgery that would really address it, like the gastric bypass instead of, let's say, the sleeve gastrectomy. Having said that, even in some patients that have mild acid reflux, doing the sleeve may actually help with that because as they lose weight, they decrease the intra-abdominal pressure, and that can help with that as well. A lot of times reflux is caused actually by the dieting habits. They may be eating too much, eating too quickly, or the right types of foods. So many times after surgery, by simply changing your dieting and eating habits, that'll actually help with your heartburn and reflux. In the small percentage of patients that do have reflux after surgery, it's usually very well managed with medication. So if you do end up having a heartburn afterwards, we can give you medicine for it. And a very, very small percentage of patients actually require further intervention besides that. Okay, the next question. Oh, do you have to purchase prepackaged meals, a full liquid diet before surgery, and what is the basis behind it? So we do offer the liquid protein diet before surgery for all of our patients. And I'll talk about the reasoning behind that in a second. But we do offer a package to all of our patients that are about to have surgery. And the reason we offer that to them is because it is number one, less expensive buying as a package, and number two, it's exactly what the patient needs. So instead of going on Amazon or going to different nutrition stores to try to find what they want, you can purchase ours and we have exactly what you need, and you know that's going to be the right thing. Now, you certainly have the ability to find your own protein shakes or things like that out in the community as well, and we can certainly give you recommendations for that if you want. But that's the reason why we offer prepackaged sets in our practice, because it's just much easier for the patient and they know what they're getting. The reason we have you do that is for 2 weeks before surgery, we put almost all of our patients on a 2-week liquid diet. And the reason is the liver lives on top of the stomach. In order to do any surgery, we have to be able to lift the liver up. Studies have shown that by putting a patient on a 2-week liquid diet, we can actually shrink the liver by about 30%. So we have much better visualization of the stomach. It's much easier to do the surgery. It's much safer and much more effective as well. In rare circumstances, if the liver is too large and we can't adequately lift the liver up to see what we need to see, we may have to stop the surgery, which is why we really encourage our patients to stick to the diet to really make the surgery as safe and as effective as possible. After the 2 weeks, certainly patients are able to eat regular foods, do mushy foods, things like that. So it's just 2 weeks before, but that's the reason why we do that. The next question is about revision surgery. So with any weight loss surgery, there's always a chance that a patient may regain weight afterwards. It's not a high possibility, but we do see patients regain weight afterwards for one reason or another. At that point, we usually evaluate the surgery you had done, whether it's sleeve, the gastric bypass, the lap band, and we see whether or not there's something we can do to potentially improve it or revise it or something like that. So for example, we have seen a lot of patients have sleeve gastrectomies from other practices that have either not lost enough weight or have regained a significant amount of weight. And we see this when we do an endoscopy. We notice that their sleeve is either too big or it's stretched out, or if there's stomach left behind, in which case doing a revision may be a good idea, where we go in and essentially redo the surgery and really make it nice and tight the way that it should be. Now, there's a ton of different variations out there, so really the best way to know whether or not you're a candidate for revision and what revision you may be a candidate for is to come in for a consultation. We can really go in depth about what surgery you had, how much weight you lost with it, how much you've regained, and really work you up from there. So we do offer the wide gamut of revisional bariatric surgery. I just want to mention that we did hire a new surgeon in our practice just a few months ago, Dr. Enox. He's actually a world-renowned expert in revisional bariatric surgery. We literally hired him just to do complex revisions. So if you've been places where maybe other surgeons said that you weren't a candidate, please give us a call. We'll certainly get you plugged in with Dr. Enox, and he'd be happy to discuss any options. He's an excellent surgeon, and he really is able to do things that not many other people are able to do.
That's awesome. It's really good to have those resources available. So the next question is for me. So is plastic surgery covered under insurance or is it out of pocket? Awesome question. We get this a lot. So what I tell people about insurance is that your insurance company is going to look at things that they think are medically necessary or functionally beneficial in some way. So there are parts of these that some insurance carriers may consider under insurance coverage. A lot of the excess skin removal and things like that, your insurance carrier may look at as something that they would cover. A lot of it depends on a couple different things. So number one, different insurance carriers definitely have different requirements. So that's why we are, we're great because we're kind of experts in dealing with different insurance plans and knowing what insurance plans require what criteria for you. But typically they're looking at the excess skin hanging, and typically this is for the belly surgery, or what's called a paniculectomy, or removing that excess lower abdominal skin. But they're going to look at, does it hang to a certain level? Are you having functional issues as a result? So back pain, things like that. Do you have recurrent rashes from the excess folding skin? And that's typically when an insurance carrier may look at covering that part of surgery. There are definitely parts of surgery that we do discuss with patients that give you a cosmetic benefit that would not be covered under insurance. But there certainly are a lot that can be covered under insurance. The other big one that we see is breast reduction surgery. So people who have neck pain, back pain, shoulder pain, rashes under the breast, that's another big one where insurance coverage would apply to that. And so the next question is also for me. So how soon after weight loss surgery can you have the excess skin removed? So that's a great question. So for us as surgeons, we typically look at people who are a year from their bariatric surgery and typically 3 months of stable weight. That is typically what most insurances will also look at as the criteria for approving excess skin removal. There are certainly some insurance carriers that look at that want to see it at 18 months from your bariatric surgery and 6 months of stable weight, though that's probably less common.
And so question, how long does it take for blood pressure to go down? So it really depends on the patient. Someone that's been recently diagnosed with hypertension, you may see the blood pressure go down almost immediately. For someone that's on several different medications, who's been on medications for a long time, it certainly may take a little bit longer. A lot of times blood pressure is actually directly related to the diet that you're taking. And so you're eating a lot of salt, a lot of fats, things like that, that can directly correlate to increased blood pressure. So we do see that some patients have a change in their blood pressure almost immediately after surgery, simply by diet modification. They're not eating as they were before after surgery, and so they can certainly notice a change in their blood pressure. I would certainly say that certainly within a few months, a year after surgery, once you've lost a significant amount of weight, we should see pretty dramatic changes in the blood pressure. And one of the goals of weight loss surgery is to really get rid of all the medications that you're on for blood pressure, diabetes, things like that. Okay, the next question. Patient had bariatric surgery about 3 months ago. Are they allowed to drink a glass of wine for Christmas? So 3 months ago, I will say, yes, you can have 1 glass of wine for Christmas because it's the holidays. In general, for weight loss surgery, we say that patients can go back to drinking a little bit of alcohol about 3 months afterwards. At that point, you're not going to hurt anything with the inside with alcohol. You're not going to damage anything. But there's a big caveat to that. Alcohol has a lot of calories. So a glass of wine, a shot of vodka or tequila, a beer, something like that has about 130 to 150 calories by itself. That's 1 glass or 1 shot. If you think about a margarita, you have a shot of tequila plus all the mixers inside. 1 drink, you're looking at probably 400 to 500 calories right there. If our goal is for you to eat under 1,000 calories a day to lose weight, and you have 2 or 3 drinks, you're about at 50% of your total daily intake just in those 2 or 3 drinks before you even reach eating your meals or things like that. And so we have unfortunately seen patients regain weight by drinking too much alcohol. So I would say, for special occasions, for Christmas, for, birthdays, things like that, yes, you can have, a little bit here and there, but you want to be very careful with it because it can certainly affect your weight loss. Some patients do also notice that it takes a lot less alcohol to get them to where they were before. So if you were able to drink maybe 3 or 4 glasses of wine before, it may only take 1 glass of wine before you're really feeling the effects. So to be safe, just go very, very slowly and don't overdo it. The next question, does your hair fall out after surgery? So that's actually a great question. We do get this a lot after surgery. So with any weight loss, whether it's with surgery, medications, by yourself, some patients do see some hair loss. The best way to prevent that is to make sure you're eating plenty of protein, and we'll certainly guide you on that, and take all your vitamins every single day. There's other vitamins like hair, skin, and nail, biotin, things like that, that can really mitigate how much hair you lose. And so while you may see some hair loss, you can really do your best to prevent it by taking your vitamins and taking your protein in. Almost always, this is a temporary hair loss, meaning if you do lose hair, once you're at your goal weight and your weight has stabilized, the hair will grow back. Are there certain vitamins that you can recommend prior to surgery and they're different after surgery if you're doing the switch? So we in general recommend that all patients take a multivitamin as well as a calcium with vitamin D. So those are the 2 things that we do want all patients to take. That's in the beginning, it'll be a chewable vitamin. We slowly transition that to a tablet or a capsule. For the duodenal switch, you will be taking those same vitamins as well. However, we will be checking your blood work more frequently. We may double up on the dosage that you take because you're not going to be absorbing as much of the vitamins as well. In some situations, if you really have a lot of vitamin deficiencies and you're really not able to keep up with oral supplementation, you may need IV infusions or shots of vitamins. They also have vitamin patches, things like that, but we'll really tailor that to the patient individually. What are the chances of blood clots after bariatric surgery? So in general, the chance of a blood clot is quite low. It's probably around 0.5%, so about 1 in 200 patients. There are certain things that increase the risk factor of that. So that includes smoking, uncontrolled diabetes, patients that have a family history of blood clots, or someone that has liver disease. So there are certain things that can increase that. Now, we do give you medicine both right before the surgery and after the surgery while in the hospital to try to prevent blood clots. The best way to prevent this is really to get up, walk around, and be active like we mentioned before.
Yeah, I'll jump in there because definitely for a lot of these body contouring surgeries, in general, risk of blood clots is very low, but definitely on the scale of elective plastic surgeries, these, abdominoplasties or lower body lifts can have a higher risk of blood clots. So I typically do what we call a Caprini score on all patients who are getting this. I ask every patient about personal or family history of blood clots. The other thing that people don't realize is recurrent miscarriages in females, if you've had 3 or more, can also increase your risk of blood clotting disorders. And so, we'll send patients to hematology, but, I always ask patients that I try to do Caprini calculations on everybody before surgery so we can catch a lot of those things ahead of time. Because that's, for me, at least, that's kind of the biggest quote unquote medical risk for surgery aside from the surgical site itself.
Sure. Do you require patients to do shots to prevent blood clots after the switch or sleeve surgery? So that's really dependent on the patient. So we really take your risk factors, your weight, and we kind of look at that and see whether or not you would benefit from getting either a blood thinning shot, or a pill to take for that. We don't routinely put every single patient on medication for blood clots because there are risks to that as well. But in patients that are high risk, you certainly may go on it for 2 to 4 weeks afterwards. That's certainly something that your surgeon will discuss with you prior to surgery, so you'll know whether or not you need that after the initial consultation when they go over all of your risk factors. If you do have a significant clotting disorder or a family history of clotting disorder, we likely would have you see a hematologist for clearance, just to make sure that you don't need to do any additional workup prior to surgery. The next question, pre-diabetic and thyroid issues, they're overweight, but their primary care physician doesn't want to clear them for surgery. So, I would still encourage that you make an appointment to come and see us. We can certainly go over all your different criteria, go over all your medical history and see if you are a candidate for surgery. And if it's something that you really want to do, we can certainly call your primary care physician ourselves and really talk to them and find out what reservations they have and why we think that you would benefit from that surgery. And so we would definitely make that outreach to try to reach out to your primary care physician. Having said that, if your primary care physician or any primary care physician really is absolutely against it, and we do see that sometimes where they're very against weight loss surgery, at the end of the day, this is your body, it's your decision. And as long as you're making an educated decision, it's something that no one has the right to tell you can or can't do outside of safety concerns. So as long as there's no safety concerns, it's your body, it's an elective procedure. We certainly can recommend other primary care physicians that, as long as we think you're a good candidate and that you're safe for surgery, I'm sure we can find one that can give you either clearance or a recommendation for the surgery. Is it possible after bariatric surgery to have a pregnancy and not gain a lot of weight? So it is normal to gain weight after any pregnancy, whether you've had weight loss surgery or not. And so that's certainly something that that you can expect, and something that's healthy. If you don't gain any weight with a pregnancy, then that's actually something we'd have to look into, because that's not entirely normal. The key is that after you give birth, that you go back to the diet you're on before, and that's how you prevent keeping the weight on. So if you go back to your pre-pregnancy diet, you should be able to lose that weight, especially with exercise, things like that as well. Is it okay to eat pork 3 weeks post-op? So in general, we want you to stick to more of a mushy puree diet. So 3 weeks post-op is a little bit too early for pork. We want you to stick to things like yogurt, cottage cheese, really mushy, like scrambled eggs, soft fish like tilapia, cod, things like that. How much do you typically like to see patients lose prior to surgery? So for that, it really depends on the patient. For someone that's very, let's say 400 pounds, we'd expect them to lose more weight than someone that's 200 pounds. So it really depends on the patient. In general, 15 to 20 pounds before surgery with the liquid diet is what we'd be looking at. If you're having revision surgery from the lap band to the sleeve, does the process take the same amount of time or a little bit less? So the process itself would take about the same amount of time. So you have to go through the whole workup to see cardiology, pulmonology, nutrition, psychology, all of that. That all takes about the same amount of time. Having said that, we usually don't take the lap band out and do the sleeve right away. We usually stage them, and we usually want to wait about 8 weeks between these two operations. And the reason is when we take the lap band out, there's a lot of scarring. Your body forms a lot of thick tissue. So we want to give your body some time to heal and recover before we do the sleeve, because the chance of having a complication immediately afterwards is a little bit higher. So we usually do stage the band removal to the sleeve for about 2 months. That gives you time to see all the other workup. So in general, there's not much of a delay, if anything. The only difference is that you would have the band removed during the time you're doing the workup towards the sleeve.
I believe that wraps up our Q&A. I don't see any more questions, so I just wanted to thank the both of you, Dr. Chiao and Dr. Shafqat, for your time this evening, and thank you everybody for joining us. Have a great evening. Thank you.
Thank you, Megan.
Thank you so much.
Thank you, everyone.